Parban, if you. Good morning, everybody. Thank you to attend this breath clinic. Today we will be talking about the exercises of the eyelids, the eye muscles, and the focusing muscle that is located inside the eyeball called the ciliary muscle. So first, if you can practice with me, that'll be very helpful. First we'll do is the function of the eyelid is to blink and open. So we'll increase the muscle strength of the blinking. So normal blinking, we do about 10 to 12 times a minute, but let's give those muscles a little bit of a jolt. So we'll blink 10 seconds, very fast blinking. Okay, so let's start. And if you can focus on the eyelids with your mental vision, that'll be helpful making the focusing on the eyelids itself. Okay, let's start. Fast blinking. Okay, just close the eyes for 5 seconds. Okay, and once more for 10 seconds, we'll blink fast. Then we'll give them rest for 5 seconds. So this was slightly nudging the orbicularis oculi muscle. And now we'll give it a little bit extra resistance. And we'll put our finger, the index finger, at the edge of the orbit where the bone, you can feel the bone going up and down. There's an angle to it. That is where the muscle is anchored. Just push on it. And now try to do the blinking. A little bit more forcefully, but you're not squeezing. You will see, you will feel actually with your finger, something is moving under your finger. It is that tendon of that orbicularis muscle that is trying to fight your finger. And so thereby the muscle is getting a bit stronger. So 7, 8, 9, 10, and give it a break for a couple of few seconds. And we'll keep our fingers tight on that tendon area. And one more time, we'll do that for 10 seconds, slightly more forcefully, but you're not squeezing the eyeball. Okay, give it one more break, and we'll work it out for one more time. And same thing, keep your finger on the bone and holding that tendon of the muscle that is closing our eyes. Once more, we'll go blink, a little bit harder than normal blinking, but not squeezing. So that is giving a workout to the orbicularis oculi muscle. So if you strengthen it, then in normal blinking, it doesn't have to do that much work. Okay, so the third one, after we take a little break, will be to squeeze the eyes, just the eyelids. And I want to give you a cautionary tale on this one. People who have glaucoma, who have had recent eye surgeries, who had a detached retina, or recent flashes and floaters, retinal detachments, any disease that you may be concerned about, dry eyes and all that don't count. So just don't squeeze the eyeball, please, because this is a ping pong sized ball. It's not plastic, it is squeezable ball, like a play ball would be. So when you squeeze it, there is a pressure inside that ball increases. So if we have glaucoma or something like that, that is damaging the optic nerve, we don't want to squeeze the eyeball because it chokes the circulation to the optic nerve. So this time what we'll do is we'll squeeze the eyelids tightly shut, hold for 5 seconds, and we'll repeat it 3 times. So now this time, close your eyes, and now you give it a squeeze. Relax. You can include your breath with it too if you wish. Inhale, and then when you exhale, now squeeze. Inhale, open. And put your mind to your eyelids as they're closing, and put your breath into it. As you exhale, squeeze. Inhale, open. Exhale, squeeze. Inhale, open. And lastly, exhale, breathe, squeeze your eyes. Okay, so we have given the strengthening to the orbicularis muscle. In many patients I see in older age, the lower lid tends to droop down. So this orbicularis muscle does not get to work as much as the upper lid does. So we will exercise that now by looking up and consciously trying to bring the lower lid up. It may be taken, it's an unnatural movement that is happening. So just consciously try to do it. Look up and pull the lower lid up. You may not feel it unless you actually touch the lower lid. You will feel the muscle working. And that's very important to keep the eyelid in contact with the eyeball as we age. Look down and slowly look up. Consciously pull the lower lid up. We want to have that eyelid margin keep touching the eyeball. It is important for functioning of the tear duct system as well. Keep looking up, count of 5, 2, 3, 4, 5. Slowly relax, look down, and we'll do it one last time. We'll slowly start looking up. And now consciously give it a jolt to your lower lids. Bring them up. There is an opening of the tear duct system I showed you last time that picks up the tears, and we do need it in contact with the eyeball. Otherwise, it cannot pick up the tears. So people in older age have constant watering of the eyes because their tears have nowhere to go. Okay, so having done that, the last one we do on the eyelid part is that we have done a lot of work to the eyelids now. So we rub our hands and generate some heat and energy, like Chi, Deepabai and Kalanbai say, create that energy and put it up against the eyelids and give it rest. This is called palming. Palming has a lot of myths that connected with it. And I described those myths to you last time, that it does not eliminate the need for glasses. It does not improve the eyesight. It just gives you a little extra heat to the eyelids and gives you comfort. So that concludes the section on the eyelids